Patient safety is very important in the healthcare delivery system today in order to provide safe care to the patient. One of the important is the medication safety. The International Patient Safety Goal talks about high alert medications should be carefully handled when they're used in the hospitals. What do you mean by high alert medications? These are the medications involved in higher percentage of errors or sentinel events. These also carry higher risk for adverse outcomes. And there are also a list of medications which are look-alike and sound-alike. So in USA, Institute of Medicine did conduct a study for 10 years and found out that 1 lakh deaths were occurring annually due to medical and medication errors. But JCI also did a study for about 10 years and found there were about 446 medication error sentinel events reported in various hospitals in USA. And in administration of anticoagulants was mostly found there were a lot of errors occurring, and they said 60,000 errors were reported to the United States Pharmacopoeia. Out of this, 60% were reaching the patient and 3% was causing death or major harm. So how do we prevent these kind of errors occurring when the patient is in the hospital? Most important is to address the people who are involved in the care of the patient and using these medications. So what are the things we can do is, first of all, to conduct an independent double check before dispensing or before administration of these high alert medications. So they found out by research that independent double check can prevent up to 95% of the errors before they reach the patient. So what we can do at the enterprise is to list out the look-alike and sound-alike and store them separately and recheck before drug dispense to the patient. And high-risk medication should be checked and verified by a second staff before dispensing and administration. All the medication should be labeled and kept it in the order near the patient or at the storage point. And loaded syringes should be labeled at all times. Extra care should be taken when patients' high alert medications like anticoagulants and electrolytes are used. Medical reconciliation should be done at all transition points, especially up-to-date list of what patients is using the medication should be enlisted. The most important enterprise level is to create policies and document it and distribute among all the people involved in the usage of medications, and ensure that these are implemented effectively, and there has to be periodic audit and monitoring mechanism to identify the errors and prevention strategies should be implemented in the enterprise to provide safe care to the patient.